Let's put the spotlight then on Plum, which is India's leading insurance tech company. And they've come out with their latest report, Health Report of Corporate India 2023. The headline of which is, Health is an afterthought for working India. Connecting with me is Saurabh Arora, the CTO and co-founder at Plum. Saurabh, thanks so much for joining in. And, just looking at the overall employment landscape, over 522 million individuals in FY22, and that's projected to grow to 569 million by 2023. What exactly is the quality healthcare that only 15% actually receive any support in the form of health insurance?
Thank you, Avanne, for having me over here. No, it's a very pertinent question that we're addressing. And we've recently come up with a corporate health report as well. It's sort of a snapshot of how the corporate health or corporate healthcare is being looked at and how corporates are faring on that. Just to give you a context, Plum is a health insurance and a healthcare provider for more than 3,500 corporates, and we have close to about 500,000 members who are insured with us and take access to healthcare with us. The findings of the report have been startling. We are looking at about 15% of corporates which generally provide healthcare needs, including health insurance, preventive care, and primary care access to the employees. And this is at the time when India is actually the highest medical inflation, is witnessing the highest medical inflation in Asia at about 14%, which means that there is already a growing rise of healthcare spends that employees and their families are doing. And when it comes to corporate providing access, we have largely been restricted to health insurance as an access. And we can talk about what kind of adequate covers health insurance are. But with this report, we are also advocating that employers need to do more. They need to not just look at health insurance, but also look at preventive care and primary care access to their employees, as the healthcare spends, the out-of-pocket spends of employees and their families is primarily coming out in various other needs in healthcare as well.
Okay. Now, I believe that soaring medical inflation as well, given that the inflation rate in India, the medical inflation rate that is one of the highest in Asia. Is that true? And how really are employees or even companies dealing with this?
Yeah, this is absolutely true. What means is that each passing year, your healthcare cost that includes hospitalization or treatments, that includes going to doctors for consultations or even getting access to medicines and diagnostics, are increasing at 14% annually. That really bears a lot of burden on the pocket of employees. And what corporate needs to do is they need to address this. They need to accept the reality that medical inflation will continue to rise. And in fact, it rises at times twice as the economic inflation. And what corporates could do generally is, because they are buying in bulk and they're buying it for a group of employees, so they have a good purchasing and negotiating power, which means that they could provide bulk of these health benefits, including insurance, preventive care, and primary care, at still decent prices. But hey, we can't escape the medical inflation that's here to stay. So the corporates just need to do better at design of where the healthcare needs are of the employees, learn from those needs, and then deploy capital and resources to cater to those needs. They can't really bring down the prices of healthcare.
So what about telehealth? Tell us a little bit more about how that really needs to be leveraged, in particular for some sensitive needs.
Yeah, no, absolutely. I think, if you look at the primary care, you have two accesses. One, there is virtual primary consultations, which is what we call telehealth. And then there is physically going to the doctors in OPD clinics. We've seen, and with Plum, we have deployed about a team of 75 doctors who are doing virtual primary consultations over our telehealth platform to close to 5 lakh members. And we have seen like a really good early adoption from employees in accessing healthcare through telehealth platforms. Even from metro and non-metro cities, we are seeing employees are not just accessing it for themselves, but they're also accessing it for their family members, primarily their parents, their children, their spouses. And if you see, there is 2-3 areas of specialties which is very popular. General practitioners are available on virtual consultations very quickly. You could, any ailment that you want to double check, even if you have a sneeze, you can reach out to general practitioners over teleconsults rather than walking into a hospital. But for specialties like dermatologies, for elderly parents, geriatric cares, for children, pediatricians, even for their pets as vets, telehealth is a really great way to access doctors at the fingertips, and we are seeing a good adoption there. If you look at the overall, there is still corporates have to do a lot. We see about 20% of the corporates still allowing their employees to access telehealth. But when it comes to OPD and physical care, it's even low. Only 1% of the corporates are giving OPD access to their employees. So there's a lot of room for corporate India to buckle up and provide adequate needs around healthcare to their employees.
Tell us a little bit more about what the data indicates when it comes to the adoption of employee-sponsored healthcare plans among young people, particularly in the 20 to 30-year-old age bracket, because I believe that has been half as compared to the employees that are age 51 and above. But wouldn't that be logical?
Yeah, it is logical, but I'll give you some numbers to begin with. So about close to 1 in 3 employees, after their corporates have provided them healthcare benefits and access, only 1 in 3 are still taking these benefits up and using these benefits. Close to about 1 in 10 employees, for instance, would use medicine discounts or discounted health checkups. 1 in 12 employees are accessing about mental health access as well. So there's generally a low adoption in employees overall, close to about 30% adoption in employees, and more so in younger population, where younger population is generally, they haven't seen health calamities, so they're not seeing this as a serious ailments coming to them yet, as compared to older population, which is what we're saying. This is a natural trend. But I do want to point out that, look, we are at a stage where witnessing had cardiac problems or cardiovascular diseases or metabolic disorders like diabetes. Type 1 diabetes is very prevalent in India. All of these are coming at very early age, and if you want to see where is it coming from, you could point this out, that what's happening in the workplaces is the sedentary lifestyles which the employees are living, even the young ones. Lack of physical activities, sleep being tossed around, and because of these sedentary lifestyles, some people also have chronic conditions and they are not supported well. These sedentary lifestyles we are witnessing a lot of younger population getting diagnosed with cardiac problems or even diabetic problems, which is quite prevalent. So our opportunity and ask to the corporate India is to educate even the younger employees, so that they learn about these health risks, and the best way to access this health risk is to go for diagnostics. So we have a really strong recommendation for corporates to go for annual health checkups across the employees, no matter they're young or old.
So tell us a little bit more then, what Plum's recommendations are to companies.
Absolutely. Look, what we are advocating is that the health insurance is not enough. And even when you're looking at health insurance, there is essentially 3 things or 3 frameworks which the corporate India has to follow. One is, what is the health insurance they're providing to the employees? What is the preventive care they're providing access to, and what is the primary care they're providing access to? So when it comes to health insurance, we have seen majority of employers today still do 3 lakhs of coverages with really low maternities of up to 45,000 or 50,000. We think this is not adequate. We have processed about 50,000 claims in the last 3 years, and we can tell you that people are paying out-of-pocket expense when you have coverage such as this. So our recommendation is to at least have 5 lakhs insurance coverage and about 1 lakh of maternity. And if you really want to go adequate, go for 10 lakhs insurance coverage and 1.5 lakhs of maternity. So this is insurance stack. Also include modern treatments, which is now have a lot of co-pays too. And when it comes to preventive care, what we are recommending is that provide for annual health checkups and provide for virtual consultations or telehealth platform where they could access nutrition or geriatric cares for elderly care management as well. And when it comes to primary care, what we are advocating is to have some sort of a health wallet as well, where the employees and their family members should be able to access various needs around healthcare, which includes medicines. Even if you're in the population, you should be able to access gyms, fitness. So create about a 50,000 rupees of health wallet where the employees could spend across the healthcare needs, which includes medicines, diagnostics, gym memberships, nutrition counseling, and so on and so forth. So across these 3 tracks of primary, preventive, and insurance.
Okay. And finally, given that the company is on a mission to accelerate the adoption of health insurance in the country by looking at really making health insurance a lot more accessible and affordable and, of course, usable for employees, tell us a little bit more about how you plan to do this.
Yeah, look, this is a mission which we are wearing on our sleeves, which is to really impact the health and financial well-being of our members of eventually. And I would say that employee health isn't just about insurance. We as corporates, as employees, we spend about a third of our working lives, a third of our lives working for our employers, and the impact on our health is undeniable. These are direct impact through sedentary lifestyles or workplace stress, or these could be indirect as well. You know, when you move to the cities to change your employers and you're leaving your healthcare, family doctors, etc., in your previous cities. So our mission here is to help corporates because we are a corporate platform, and we believe that the bigger penetration of healthcare access and insurance in India is going to come from the corporates, where the employers and employees share a relationship, and there is about 50 crore Indians who are right now employed in the workforce, but only 15% of them have access to healthcare. So our mission is to really go to these corporates and help them with the best design, the best plans, so that they could deploy the healthcare access to the needs of their employees.
Good to have you on board. Thank you so much for bringing to light all of those very startling statistics and how Plum as a company as well is looking to really accelerate the adoption of health insurance.
Thank you so much, Avanne, for having me here.